Hello, and welcome to this episode of Let's Talk Careers. My name is Claudia Mellad, and I'm your host for today. In this conversation, we'll meet with a good friend of mine, Belinda Brammah, who's a registered nurse who works currently in both the private and public sectors. We will discuss the variety of employment options available to nurses, the key differences between the public and the private sectors, and the factors to consider when making a career decision. What do we keep in mind when we do this? I really hope you all enjoy this next episode. Can you tell us a little bit about yourself, introduce yourself to our audience?
Oh, okay. So good morning. Thank you for having me. My name's Belinda. I've been in nursing for about 17 years.
Wow.
Mainly working at the bedside and then also working in the private sector as a nurse manager.
Perfect. Well, thank you for that. That's an awesome introduction. So can you tell us a little bit about your first job, either as a young graduate or, ever in life? What was your first opportunity?
Yeah. So when I graduated Ryerson University from their nursing program, I worked at St. Mike's Hospital in the orthopedic unit, and I was there for about a year.
What was your first paid job in life?
Oh, in life. So I guess I was in high school and I worked at Mark's Work Warehouse. Mm-hmm. So I worked on like a sales associate / cashier. That was my first job, I believe, making $8 an hour.
Long time ago.
Yeah, a long time ago. But yeah, that was my first job was retail.
And I always talk to students about transferable skills. What would you say some of the transferable skills are that you got from that retail job that you can actually use in nursing?
Yeah, so for sure, off the bat, I would say customer service. In any aspect of healthcare and nursing, it's all patient front facing. So it's all about customer service. So I would say for me, that would be transferable skills. Dealing with irate customers in the retail setting, mm-hmm. and knowing how to, mediate conflict or issues there. So being able to transfer that into the hospital setting was beneficial.
Absolutely. No, that's great. So at what point throughout your high school career did you know you wanted to become a nurse?
So I'll be honest, for me, it was quite an interesting journey. So I've always had an interest in science and math. Originally, I actually wanted to be an accountant.
Oh, wow.
Yeah.
That's quite a difference.
It is quite a difference. And or focus in mathematics and possibly open up my own tutoring math center.
Okay.
How I got into nursing is I had family members, a lot of aunts that were nursing. And my mom was sick at one point and I had to take care of her, and being in the hospital made me realize that was more my calling. Mm-hmm. And that's how I kind of transitioned over into healthcare.
It's interesting, though, because it's such a transition from mathematics and accounting to nursing. Mathematics and accounting is so behind the scenes.
Yes.
And nursing is so in front of the scenes, so front facing and so much forward.
It's funny, but I still do use math in terms of med calculations.
Of course.
So that has been helpful.
Absolutely.
Sure.
Mathematics are important. You don't want the nurses to screw up
No.
your medication, your dosage. So that's really important. So students, study your math.
Yes.
Yeah. And what are some things you experienced as a new nurse and a new grad?
Yeah. So being a new grad in the hospital was a bit daunting, a bit fearful, kind of developing my skills, my critical thinking skills, as well as my experience. But I learned a lot. And I was able to explore different areas of nursing. So at one point I did do agency nursing and then eventually transitioned to a different institution and department as well.
That's great. So just expanding on that, above and beyond being a new grad, can you tell us a little bit about your career journey?
Yeah. So my career journey, I started off at the bedside. I've been at the bedside for full time, a total of, I would say, about 12 years. For me, in order to have a better work-life balance, I decided to transition out from the public sector into the private sector. So currently I work as a nurse manager for a private company overseeing infusion clinics in our GTA area.
Okay, impressive career. And you kind of touched on a key point there. So switching from private sector to public sector,
Mhm.
what was that experience like? And what are some of the differences between the two?
Yeah. So for me, like I mentioned, it was just more a better work-life balance for myself. At one point, I unfortunately did develop a bit of burnout at the bedside. So I did want something that was a bit more conducive to a better peaceful work environment and life balance. So, yeah, the difference with public versus private is the pay. I will be honest. So it is you do take a bit of a pay cut in the private sector, but management opportunity is definitely available, as well as different learning opportunities.
Absolutely. And you have to really think about just your life in general, and work-life balance is so important to so many
Mhm.
people. So that's great to hear. What would you say is the most fulfilling aspect of your current role?
So I would say the most fulfilling aspect of my current role would be working with various individuals as well as interdisciplinary team members, being able to help nurses transition as well from the hospital to public sector or private sector, sorry. Uh, and helping patients as well with management of their conditions. So that I would say would be fulfilling.
Okay, absolutely. That's great. And then on the flip side, what would you say some of the challenges you faced during your career, whether it's this current role or your previous opportunities?
I so challenges for me would be kind of changing my mindset in terms of the security of the pension, security of union and seniority. So changing my mindset in regards to that and focusing, as I mentioned, more on a better work-life balance for myself. Stepping away from shift work, having to work 12 hours, rotation of day and night. It does take you away from, your family life. So working in the private sector where it's a Monday to Friday, 9 to 5 was a bit better for myself.
Absolutely. Having a more predictable schedule, Monday to
Hmm.
Friday, 9 to 5, gives you time for family, friends, and other things that
Yes.
that matter, right? Um, so, have you ever had a mentor, or do you mentor other people?
I haven't had a mentor. And I guess in my hospital role previously, I somewhat mentored in terms of new hires or nursing students that we had on the unit. Currently, I don't mentor, but I have previously.
Okay. And what would you say, just from your experience, and formally doing it, are some of the benefits of mentorship?
It helps with providing a good direction in terms of where you see yourself in terms of your nursing career. And it's also like a nice checkpoint in terms of like just checking in with your own um, nursing style or even critical thinking. So it kind of like a second person who helps to reassure you
Hmm.
in those areas where you may
Absolutely.
not feel as confident.
Absolutely. No, that's amazing. And this is totally off rails. And it just came to me right now. Were you working in the hospital during the COVID-19 pandemic?
Yes, I was.
And
Yeah.
what was that experience like?
Yeah, so it was intense. We did work understaffed, unfortunately. So we had to make do with lack of resources and lack of additional nursing support. But the unit that I work on, we have a very family based way of working with each other. So we were able to cope.
Amazing.
Yeah.
Thank you. Thank you for that. Because honestly, no one really knows what it's truly like, until you actually speak to someone who was there on the front lines dealing with that every day for years.
Yeah.
So thank you for all that
Thank
you've done
you.
in that regard. And we've mentioned this several times. How do you balance work and life? Does work-life balance actually exist?
I think it's individual, so it depends on the person. Me personally, it exists in my life because I made sure of that. And again, by reflecting and making that choice to leave the bedside. So, yes, for me, it does exist. I have a teenager, he's 14, so I'm heavily involved in, his extracurriculars as well as his education. So, for me, working a traditional Monday to Friday, 9 to 5, it helps in that regards.
Oh, that's great.
Yeah.
That's great. Spending time with family is super crucial and key. And I guess this is kind of segues into that, but how do you make career decisions? Is your son a part of your decision making, or how do you make your career decisions or moves?
So for me, he's definitely at the forefront of all decision making that I have, as well as myself. So yeah, I try to make sure I'm taking into account the amount of time that I'll be away from home, and as well as how much support he will need and require from me.
So in terms of that, so, making career decisions based off of your son, based off of yourself, but is there anything else that comes into play when you're making your career decisions? Do you think about, company culture? You mentioned distance, but what are other aspects that you think about?
Yeah. So I guess for me, I look at growth opportunity as well. So where I'm currently working in the private sector, I work as a nurse manager. I do oversee private clinics for outpatients. So that's a different aspect of nursing than working at the bedside. And there is growth opportunity there. So I do look at promotion opportunities in different areas of growth in that sector. So yeah.
No, that's great. And I mean, you've been a frontline nurse and now you are a manager. What would you say, I guess, the biggest challenge was stepping out from being a frontline nurse to now being a manager of staff?
Yeah. So being in that leadership role, it's a bit different, and a little bit of an adjustment. Not too much so, because in the public sector, in the hospital, I am considered a senior nurse. So I do find, our novice nurses and new hires do tend to come to us senior nurses for support. So being able to have that leadership quality was somewhat there already in my new management role. But it is definitely a profession or a position where you have to be able to communicate well within the organization as well as the patients.
I think everybody's problems become your problems when you're a manager.
Yes.
When you switch from being a frontline staff, you're just independent, doing your own thing. Whereas in a leadership role, now you got to think about the patients and your coworkers and your colleagues, and this person needs sick time. So it's quite an adjustment.
Yes.
So I can imagine how it is in that setting where it's life or death, literally.
Yes.
So yeah, kudos to you for being able to do it successfully. So you mentioned that you're in the private sector now. What would you say is your, I guess, best success story since joining the team?
I guess success story would be the growth or rapid growth of our company. So currently we're looking to open more infusion clinics for our patients nationally. So being able to kind of spearhead that is what I would say is a positive benefit to working with this organization.
Can you tell me a little bit more about, so you mentioned infusion clinics for the audience or people that are watching. What does that mean?
Yeah, so currently our patient population in our outpatient infusion clinics are patients with autoimmune disorders. So that would be patients who suffer from rheumatoid arthritis, Crohn's disease, ulcerative colitis. And what we do in our infusion clinics is we're providing ongoing maintenance for these patients. So they come in for infusions of biologics, so immunosuppressant therapy, depending on the frequency, whether it's every 4 weeks, 6 weeks, 8 weeks. So we do build like a really great positive rapport with a lot of our patients, and we're part of their treatment and management of their condition. Yeah.
I can imagine, because they're coming in for their infusions on a weekly, bi-weekly, a monthly basis. So they get to know the nurses that are within the clinic. So that's great. Thank you for that. And what projects would you say you're currently working on at your current company?
So it would just be the continuing growth. So opening up more of our pharmacies as well as our infusion clinics nationally, as well as, I guess, onboarding more staff and just increasing in those areas.
And what trends would you see impacting the nursing industry? What's happening in nursing?
Yeah, so I am seeing a movement of nurses from the bedside to the private sector. Also seeing trends of cosmetic nursing is a popular area of nursing right now.
So just to interrupt you there, so cosmetic nursing, that's things like fillers,
Botox, yeah.
injections, stuff to make people look beautiful.
Yes.
Okay.
Yes.
So there's money in that.
There is money in that. And I'm finding that a lot of nurses, they're able to work independently.
Okay.
Obviously needing a director, a medical director. So whether that's a nurse practitioner or a physician. But if you do have a medical director, a lot of them are able to open up their own medi spas and kind of be their own bosses, which is nice.
Mm-hmm. Is that something you've considered for yourself?
Yeah, I kind of dabbled in that, to be honest. I do freelance a little bit in the cosmetic area of nursing. So I do have a medical director that I work under, and I freelance very casually in their dermatology clinic. But yeah.
That's amazing. That's an amazing side hustle.
Yeah.
Like a cosmetic nurse on the side. That is really cool. I'm glad to hear that. And artificial intelligence, is everywhere.
Mm-hmm.
Do you see any impacts of artificial intelligence on the nursing industry? And if so, how?
Yeah, that's a great question. Personally, I'll be honest, I don't know how that would implement in the nursing profession just because it's so hands-on and you need to have very strong rapport with your patients.
Mm-hmm.
So I don't really see how AI can replace that.
Yeah.
Not to say it can't, but
Right.
I just personally can't think of how that would replace nurses.
Right. I can't imagine having a robot doing my IV.
Putting an IV in, yeah.
That's actually scary. I wouldn't trust that.
Or doing a dressing or something, yeah.
Yeah. Yeah. It's interesting how it's had such a huge impact on some industries and not so much in others, but nursing is very hands-on,
Mm-hmm.
right? So there's no real way a robot could support that, right? So, okay. And most of us have had key pivotal moments in our career journey and our career path. What, if anything, was one for you?
Yeah, so my pivotal moment I kind of touched on was me realizing my burnout at the bedside and knowing that I needed to make a career change, not just for myself, but for my family structure. So transitioning into the private sector, into management, into a whole nother area of nursing that I did not necessarily think of, that I would say was a pivotal moment for myself.
Okay. And you mentioned that you worked at the hospital as well as with the private company. Can you tell us a little bit about one of those companies that you work for?
Yeah. So I work at University Health Network, Toronto General. I am a staff nurse there. I continue to work as a staff nurse casually just to maintain my skills. In the private company that I work for, I'm a manager, so I'm not doing a lot of clinical. It's more administrative and leadership overseeing of staff as well as patients. So yeah, in the hospital sector, I'm doing what a staff nurse would do. So taking care of patients.
So we're going to kind of switch gears a bit and talk about next steps and career advice that you would give for students. So what skills do you think students would need to have in the next 5 to 10 years if they want to, tap into the nursing industry?
Yeah, so definitely developing their confidence and critical thinking. So I always advise new nurses, new hires, nursing students to gain as much experience as they can at the bedside, but not to get stuck there. And there's other areas of nursing that you can get into. So always developing and gaining learning opportunities as much as you can. So whether that's through your employer or independently on your own, definitely focusing on education.
Absolutely. And of all the courses, hopefully you can remember this, that you've taken in university, college along the way, what would you say was the course that was most important or the one that you most used in your actual career?
Yeah, I would say was the clinical placements, so the actual hands-on. We also had labs that I remember. So that was really helpful and useful in terms of the body systems and going through that with your teacher. But I would say would be the preceptor clinical placements. So it typically would be a group of 8 to 10 students. You have your faculty advisor and you would be placed in the hospital.
So you're kind of working with a nurse alongside a nurse following those nurses' shifts. So if they have a
Yes.
day shift, you're on the day shift. If they have a
Yes.
night shift, you're on the night shift.
Yes.
That must be hard.
Yeah. When you're in school and having to write papers and
Yeah.
study, it can get a bit daunting, but you make it work.
And with that being said, what's, I guess, a piece of advice you would have for a nursing student or an up and coming nursing student?
I guess my advice, like I said, would be just not getting stuck at the bedside. If that is your passion, then for sure, definitely excel in that. But knowing that there's so many different areas of nursing, I alone am at the bedside in management, in cosmetic nursing. There's nursing informatics. There's a plethora of areas of nursing that you can get into. So, and not just thinking public. Even though private has a reputation of lower pay, sometimes it's, as I mentioned, a better work-life balance. So it kind of compensates.
My other question for you is, would you advise all nursing graduates to work in the hospital for a little bit of time before branching off to other areas of nursing?
100%. I do advise nurses at a minimum of 2 years, 1 to 2 years for sure.
Because those skills are so key and
Yes.
crucial for everything that you do.
Yeah.
So you mentioned earlier that you did experience burnout, initially when you started, your nursing career. Can you tell me a little bit more about that?
Yeah. So for me, it was around the 10 to 12 year mark that I was at the bedside. Burnout for me, it was a bit of a combination of things. So it was more so lack of resources and nursing shortage. So the expectation of us working with less to produce the same amount of care, which is a bit unrealistic. So that was a bit that was quite heavy and difficult to navigate. And then managing patients' expectations within those conditions. Sometimes they're the I guess quality of care that they're wanting or that they are deserving as well. It's hard to provide when lack of resources are there and there's a shortage of nurses. So I definitely had to reflect on what would be the best way for me to help people and provide the best care that I can. And that was to step aside or even just reduce my hours at the bedside and look into a different area.
Absolutely. And when I think about just healthcare in general, when someone in a family is sick, it's the entire family that kind of rallies around them.
Exactly.
So what's your experience like working with families on top of the patient? How was that?
It can be a bit difficult, depending. And sometimes it's a great rapport. We have families that are very much active and involved and, want to be updated on every aspect of their family member's care. And, come and visit regularly. They actually are involved in providing, everyday ADLs, activity of daily living for their family members. So it does help the nurses. So for me, the experience has been positive. I mean, in everything, there's a little bit of negative, but I don't tend to focus on that. So, and I realize that people are in stressful situations. So I try not to hold it as a personal attack on me. I just know that their family member's sick, they're overwhelmed, they have their own life issues going on, and then having to assist and deal with, their family member on top of that. So I'm realizing that they're in stressful situations as well too. So,
So being understanding, being patient, just listening to them and going along the way definitely helps for sure. I guess any final tips, advice, suggestions for our students or our audience?
So I would just say, definitely follow your passion, follow your dreams. Don't be complacent. Don't be stagnant. Don't get stuck at the bedside if that's not, where your focus is. And then just ongoing learning and, education opportunities. And if it could be company sponsored,
yes,
that's a plus.
Absolutely. And we always tell our students in the career management and career success courses that a career is, not simply a job, and it's not stagnant, and lifelong learning is so important.
Yes.
So thank you for echoing all that. And thank you for coming in this morning.
Thank you for having me.
What an inspiring conversation. Thank you for listening to this episode of Let's Talk Careers. If you like this episode and want to hear more, follow us on Spotify and subscribe to us on YouTube. See you in the next one.